So we're going to change pace here a little bit and move to a case of recurrent ovarian cancer, platinum sensitive. This is a 58-year young, in Tom's words, female diagnosed with stage 4 ovarian cancer, high-grade serous. She is BRCA1 mutated, CA125 elevated at 460. She underwent suboptimal debulking, residual disease of 1.5 centimeters. She received IV carboplatin and Taxol, achieved a partial remission, and then was continued on olaparib maintenance. So 12 months later, her symptoms returned. Multifocal recurrence within the abdominal cavity. CA125, again, elevated, good performance status. She received another 6 cycles of carboplatin Taxol, this time with Bev added, and achieved a good partial response. And a CA125 is decreased, but still slightly elevated at 45. So I'm going to just open these questions up for a little bit of panel discussion. Do you agree with the second line choice there, the treatment with carbotaxol Bev? If one of you could take up this discussion of what about secondary cytoreduction, re-resection? Why don't we start there, and then we'll kind of move through these questions as we go. So, Tom, do you want to take a first stab at this?
Yeah. So I'm assuming she progressed on olaparib, which is disappointing, but it's obviously going to occur at times. So the second line of therapy, I think, is fine. Carbotaxol, Bev, carbodoxol, Bev, carbogem, Bev, I think are all good. So I think those are all good. And I think maintenance, again, is going to be answered. And we're very fortunate to have Shannon on, because she's instrumental in designing these PARP after PARP questions that are going to be need to be addressed. And this is a classic case for that. So I'm going to kind of go off into the weeds a little bit and say that, re-resection, would you consider that? Because this patient's young and healthy, and I know that the secondary surgical cytoreduction with Dr. Coleman, great study, great GOG trial, didn't really show a benefit, but I think BRCA patients are sometimes a little bit different. So I do think that considering re-resection, and then I know that HIPEC is controversial at best, I think, but I also do think that there's a role for that, and I think we need to come up with biomarkers for that. So there's the textbook answer, then there's the options. I would probably have present to this patient that she didn't receive IV/IP chemotherapy, that consideration for a re-resection, consideration for IV/IP chemotherapy treatment in the recurrent setting, as well as HIPEC. And I know that those are all very controversial, and probably saying those to a fellowship around a bunch of fellows, there would be a lot of criticism from fellows and faculty around. But I do think that in the appropriately selected patient, that to consider that, but I'd have to say it's not standard of care. So I agree with what they did, but I also think that you had additional options for those folks. So if I had to take a choice, I would be on the arguing side that I would re-resect this patient. If somebody said, do you want to be pro or con? I would have no problem being on the pro side, knowing that I have an uphill battle with data to overcome.
And you like Bev in this circumstance too?
Yeah, I would do Bev in this circumstance. Obviously, clinical trials is the #1 thing. I mean, I think we have to answer the question of PARP after PARP. There's no doubt about it. I think that's going to be very, very important. This patient progressed on PARP, so the utility of PARP in that instance is probably going to be a little bit different, but we don't know yet. And what can we resensitize to PARP? I thought it was fascinating last year's NRG, a great debate that you guys had, and then providing quite a few combination therapies. So to me, I think this is an area of an investigation. So clinical trial would definitely be high on the list. I thought their choice was fine, but I would have to say that patients at times get referred to some people because they'll operate. And so I would actually say not a great option, but if you want to go outside the box, I would consider it.